Hi, I'm Dr. Dan Mills, and you're watching the Plastic Surgery Channel.
Welcome back to Plastic Surgery News. When it comes to a full victory over breast cancer, defeating the disease is often only half the battle. Many women undergo breast reconstruction after a mastectomy, a process that can include rebuilding the breast through surgical flaps or implants, fabricating the nipple, and even nipple tattooing to produce a natural-looking skin color. Sadly, breast reconstruction surgery is highly common, with nearly 80,000 reconstructions performed each year, according to the American Society of Plastic Surgeons. But the final appearance can be crucial to a woman's sense of well-being. Fortunately, new techniques developed over the past several years are giving more and more women who undergo breast reconstruction reason to feel whole again. One such technique involves recreating the nipple mound using the adjacent tissue that provides the extra projection on the breast mound and has a different texture from that of the breast. As a final step after the breast and nipple have been rebuilt, patients can undergo nipple tattooing. The tattoos are usually added months after the other operations are complete. Creating the nipple tattoo is actually a multi-step procedure using electric needles and colored dye to add a natural-looking areolar surface and can make post-operation scarring less obvious. Specialist Barbara Shimoda, who performs the procedure for Timeless Image Aesthetics in New York City, explained that if the scarring is very heavy, the skin may reject the tattoo ink. To prevent this, she often has to break down any heavy scarring with a laser or with microdermabrasion. Breast reconstruction is generally covered by insurance and beginning to end can range in price from around $6,500 to more than $11,000. Even so, some women choose not to undergo breast reconstruction after cancer surgery, choosing instead to focus simply on the fact that they conquered the disease. Meanwhile, what's in a name? Well, when it comes to the tools used in cosmetic surgery, it seems the brand itself has become more important than ever. More and more healthcare providers are offering branded tools and services, specifically cosmetic surgery offices, that purchase laser-assisted liposuction machines with zippy names like Smart Lipo, Vaser, Zerona, and AccuSculpt. The idea behind the popular purchases is to make the surgery offices stand out to prospective customers who are already familiar with these brands. The manufacturers of these machines often provide extensive marketing resources, plus incentives to the doctors who agree to use their products. The result is that, as in many other industries, some machines have become more popular and widely sought than ones that may be safer and easier to use. Still, some experts are skeptical of the branding wave. We spoke to Dr. Robert Singer, the past president of the American Society for Aesthetic Plastic Surgery and the Aesthetic Society Education and Research Foundation. Dr. Singer helped establish the Emerging Trends Hot Topics Task Force to examine developing trends in the field of plastic surgery more closely.
The question comes up whether there are problems with the many promises that you see from branded procedures like laser lipo, smart lipo, fast lipo. There's a multitude of these different procedures and technologies out there. The problem is in the wrong clinical setting, the results may not come close to the promise made in the advertising. It may not be the best option for your particular situation. Every patient is individual. Their anatomy is an individual. And what this attempts to do is fit the patient to the procedure rather than the opposite way around. And the best thing one can do is find a board-certified plastic surgeon because there is no replacement for the judgment of the surgeon. It's not the technology that does the procedure, it's the individual at the end of the cannula.
Despite the lack of data, more and more patients may be looking to brand names for laser liposuction. Although the American Society of Plastic Surgery recently reported that liposuction surgeries are down 19% since the beginning of the economic recession in 2008, office-based cosmetic procedures have increased by 13%. And so, in time, the popularity of brand name treatments and the convenience of in-office procedures may drive more people to get liposuction and offset the downward trend.
An important thing to realize is that anybody can buy this technology, any physician. They don't have to be appropriately trained. In fact, many of them who use this may have minimal or essentially no training. Also, there may be no oversight of the facility in which they're performing the procedure. They may lack accreditation, which looks at sterility, looks at appropriate policies of handling patients, looks at appropriate personnel. So with that, the most important thing is that it be done in an accredited facility by a board-certified plastic surgeon with an appropriate anesthesia provider.
And it's time for a quick break, but we'll be right back with more plastic surgery news, including the results of a survey that explores how many of us feel about beauty as we get older. We'll be right back.